Our next presenter, our next session is Radiology Benefit Management Companies today and tomorrow. Our speaker is Barbara
Ossiass.
Ossiass.
It's Romanian for Smith.
Ossiass has more than 2 decades of experience working in reimbursement and issues related to medical imaging, nuclear medicine, and radiation oncology. She has represented manufacturers and coalitions, including the Medical Imaging Contrast Agents Association and Coalition of Radiopharmaceuticals and Radionuclides, and has been an invited speaker at state, national, and international meetings since 1989. Her firm, Reimbursement Revenue Solutions, is located in Washington, D.C. metropolitan area and includes Aurora Imaging Technology, Bayer, Bracco, and Philips among its medical imaging clients. Her presentation today is sponsored by Aurora. Ladies and gentlemen, please welcome Barbara Ossiass.
Nice job. Thank you.
Thank you.
So I really appreciate the opportunity to be here today. I have a question or two for you guys before we get started. How many of you are involved or get the negative feedback or the positive feedback on radiology benefit management and pre-certifications? How many of you feel like it's something you're really comfortable with and everything is going just great in your facility? Is anyone here secretly from Med Solutions? They're headquartered here. I needed to ask. When we talk about radiology benefit management companies, I do these reimbursement things all over the country for Bayer, and when we get to this section, it's really interesting. You will almost feel an audible groan. Oh, because it has gotten to be a lot more of an issue in the past decade, and unfortunately it's going to be more of an issue going forward, especially when we talk about healthcare reform. What I want to do today is basically talk about why payers use radiology benefit management companies, who the major players are, and that includes our friends here in Nashville, Med Solutions, and how they work. I want to talk about dealing successfully with radiology benefit management companies and what's happening in the future. I'm sure you've heard some rumblings that Medicare will be going into the pre-certification business in the next few years. How scary is that? And then we'll have a lot of time for Q&A. But with regard to Q&A, if you have a question as I'm talking or a comment, interrupt me. I have teenagers. I'm interrupted all the time. I'm very comfortable with it. And also, I feel like I learn more from you all when I'm going around the country talking than I really learn from talking to the RBMs, because they will tell you, the canned thing and say this is how it always works. Well, how it always works isn't how it really works for you all out in the field. Do we have a pretty good representation from all over the country here today? Good. Any feedback you have would be appreciated. I like this because the way I think of radiology benefit management companies is they are gatekeepers. They are the gate between you and the procedure that you want to do for your client, your customer. To give the devil their due, there is a reason why radiology benefit management companies are growing. There is a reason why payers are using them. If you look at medical imaging, it is the fastest growing area in all of healthcare spending in the past decade. And it's just going to keep growing. Now, in a vacuum is how they look at it. They just look at the fact that things keep growing. There was a government accounting office and America's Health Insurance Plan project that tracked the growth. Look at this number. This is 20%. They're expecting annual growth, not growth over that 5-year period of 20%, but 20% a year. So think of yourselves as walking around wearing a white t-shirt with a big red bullseye. The numbers really are staggering. These are some procedures that, a decade ago, how often were you talking about doing, a breast MRI? A decade ago, were you talking about doing virtual colonoscopy or CT colonography, whatever you want to call it? Look at how these areas are expanding and growing. Now, we'll just use 2 as examples. If you look at the virtual colonoscopy, the second one, just a few years ago, 2005 was not that long ago, although it really sounds it sometimes. They only did 35,000 virtual colonoscopies for the entire year. Now, they were pricey. The $35,000 came with a price tag of $10.5 million. It is projected that next year, 2010, and how weird does that sound to say, they're going to be doing at least 350,000 virtual colonoscopies with a cost of $105 million. This scares the payers. They see the growth in these procedures. A lot of times they're not arguing the worth of the procedure. They're worrying about the cost. Breast MR is the other one. Is anyone here doing breast MR? Because as I said, Aurora Imaging Technology is my sponsor for today's talk, and they were my first client many years ago when I left Amersham and started my own company, so they're family. We are seeing within our business a real explosion of the breast MR. I know as I go to meetings, I'm getting more and more questions from people doing breast MR. In 2005, there were only 130,000 procedures, breast MR procedures done. And again, it's a fairly high price tag for that few procedures, $52 million. This number, I think, is low. If you look at the number that is anticipated for next year, they're anticipating doing 1 million. I would not be surprised if it were at least 20% higher, with a price tag, though, of $400 million. So if you are a payer, to your credit, they're worried. They see these dollar amounts, and they are bottom line business people. And as long as we do have the private payers, they are going to operate like business people, and they worry about growth. Well, what's behind all the numbers? If you heard my intro, you know that I really am part of the aging population. I'm doing things since 1989. When you hear someone say that, it's terrifying. But we are overall an aging population. And an aging population, couple that with the technology advances we're seeing, and the fact that we now have this direct-to-patient advertising. How many of you really want to see some of these commercials at dinner? How many of you with little kids want to explain what some of those products are at dinner? We have seen, I think, a huge growth in medical imaging because people are more cognizant of what's out there. A good example is my Aunt Pearl in Long Island City in Queens. Aunt Pearl is 90. Aunt Pearl can tell you exactly what medical imaging procedure she needs for anything when she goes into the doctor. She's very informed, and she gets on these AARP blogs. And she blogs. She was on there blogging, telling another little old lady that if you're afraid to get a colonoscopy, you can get a CT. CT colonoscopy, she has a weird word for it, I can't remember right now, but she's basically selling virtual colonoscopy. And so put all these things together.